For many decades, there have been major questions about the similarities and differences between depressive symptoms among children, adolescents, and adults. Halsdorfsdatter report important new genetic findings that use genetic data among adults to generate what are called polygenic risk scores and evaluate the degree to which they carry implications among children and adolescents. The important findings from this new study reveal that genetic information gleaned from studies of adults with major depressive disorder does in fact relate to symptoms of major depressive disorder in children and adolescents. And the important observations here relate to the fact that particularly large, methodologically rigorous studies are performed in a way that helps us appreciate the similarities in the genetic correlates of major depressive disorder across the lifespan. The Genome-Wide Association Study, or GWAS technique, is one of the most important breakthroughs in recent research on genetics. And we are seeing an increasingly large number of GWAS studies in the field of psychiatry. Mullins and colleagues report important new data using this GWAS approach to ask questions about the genetic correlates of suicide-related variables in individuals with a major depressive disorder diagnosis. And there are a couple of take-home points that readers should draw from the article. One is that we need to think of suicide-related behaviors as unique phenotypes in their own right. So the genetic correlates of suicide-related behavior might be distinguishable from the correlates of other features of major depressive disorder. Second, the ability of studies to tease apart these genetic correlates, which ones relate to suicide-related behaviors and which ones relate to other features of mood disorders, is still not substantial. So the study only provides preliminary evidence on the unique, distinct genetic correlates of these two clinical phenotypes: non-suicidal aspects of major depressive disorder diagnosis and suicidal behaviors in individuals with major depressive disorder.